Well, I graduated in May 2019 from NYU, but had been an RN for about 6 or 7 years before that. So I'd had a lot of experiences with great mentors and not so great mentors. And in my clinical experience from NYU, I got to see a lot of different shades of support for the primary care NP. And I had a lot of really great advice from one of them who'd been a preceptor of mine when I was a nursing student. And she and I had remained in touch, and she was a DNP. And I asked her what it was about being a DNP she really liked. And she said, it had to do with her experience. Her first job, she had an attending physician who was her collaborating physician, but it was also the beginning of July. So he also had interns, and there was nobody to guide her. And her DNP allowed her to create a curriculum for new nurse practitioners starting in that particular unit. And I realized that when I graduated, I wanted to be in an environment where I could speak up, where I could ask questions, and I had multiple people as resources. So that really, thankfully, has come to fruition, because I have one collaborating physician who I work with specifically, but another one who is working with me in a learning and development for the specialty that I work in, which is functional medicine. So I also have a whole team of doctors that I can collaborate with, and we do cases weekly and have open office hours where we talk about different topics. So I've been very fortunate in that, but I think seeing nurse practitioners with experience and new nurse practitioners who were my peers as RNs and then moving into that NP role have varying levels of support from their preceptors and collaborating physicians.
Great. Thank you, Annie. Good morning, everyone. Thank you for the opportunity to share. I'm Angela Patterson, and I am the Chief Nurse Practitioner Officer for an organization, and some of the key responsibilities of my role include leading our workforce of a little more than 3,000 nurse practitioners who staff our ambulatory care clinics across the country. I also lead our organization's clinical education and training programs, our workforce development programs, and our quality program. And myself, having been a family nurse practitioner for more than 30 years and always one who loved supporting our workforce, it's always been a deep commitment of mine, and certainly within our organization, to support our nurse practitioner workforce. And I'd like to focus my comments and my shared story this morning relative to supporting our newest nurse practitioners, our new grads, and in particular their transition to practice. Within the organization, we have the privilege of providing more than 1,000 NP student preceptorships within our clinic each year, and we welcome new graduate nurse practitioners into our organization, and certainly their success and their support is critical, not only for our organization, but also for our profession. As one of the things that is a concern is an unsuccessful first transition to practice year can not only create a very poor quality provider experience and employer experience for the practitioner, but there's also a risk of that practitioner, that new practitioner, of considering whether or not our profession is the right profession for that person. And so working to support practitioners in their transition to practice year is really important, and work that I have been engaged in for many years. And I'm going to share a story, an interaction I had this past year with a new grad practitioner that I think really kind of pulls together the focus and the commitment around this as an employer. So this past year, I was called by one of our recruiting leaders, and within our organization, we receive hundreds and thousands of applications each year, whether for student preceptorships or for positions. And so there are hundreds of opportunities each year to connect with practitioners and specifically have conversations with soon-to-graduate students or new graduates. And I received a call, and the recruiting leader had said to me, you know, there's this wonderful new graduate nurse practitioner who has applied for one of our positions, and I just think she would be fabulous in our organization. And she's entertaining several other opportunities as well, and she has some concerns about having a successful onboarding transition to practice year, and would you be willing to talk to her? Because I think it would be really great for her to hear from you as our Chief Nurse Practitioner Officer, but also to share your commitment and some of the things that we've learned and put in place to support. So I said, sure. So shortly thereafter, I had a great conversation with a new graduate by the name of Carrie, who really embodied so many of the key themes and points around how do we as employers help and support our new graduates, and mentorship being an important part of that as they launch into their career and hopefully a very successful and long career. So in talking with Carrie, she was super open and was interviewing me up like a storm, which was wonderful. And she shared with me her key worry cards. And first and foremost, it was around, okay, Angela, tell me about how your organization is going to support me, particularly as I launch my career post-graduation, support me in helping to build my clinical competence and confidence relative to clinical practice, but also operationally. Some of the things that I'm worrying about are things like time management. How do I effectively juggle seeing patients, working with paraprofessionals, keeping up with education and training, staying up to date with evidence-based practice, doing administrative work and not ending up there in the clinics till 10 o'clock at night or working off hours, those kinds of things. How can you help me with that? And another area that she brought up, which is so common right now, is tell me about how the organization as an employer is going to support me in achieving my work-life balance goals. So over the years, I've learned work-life balance is really attached to, an individual definition. And so and it usually begets more seeking to understand conversation. So I said, tell me more about that. What does work-life balance look like for you? And she shared things around flexibility in schedules, getting out on time. What does the company offer relative to programs and supports for time away, continuing education? The ability for her to do things outside of work, personally, family-wise, with friends that are very meaningful to her. And how do I put all of that together to make it work so I can really embrace the work when I'm there at the practice? And then the last question she had for me, which I'm seeing much, much more of this, and I think it is so telling around how new graduates are really assimilating the changes in our healthcare industry, non-traditional partners, novel healthcare delivery venues and platforms. She asked me to help, how was our organization going to help her understand how business and clinical practice intersect? So how do I, in delivering healthcare, how do I do that and at the same time be a good steward of our business model and our group practice? Are you going to be able to help me put all of those things together? So there was a lot for me to respond to. And I share this example because she really allowed me, first of all, I had to do thinking and an inventory around what are all those things that, we as an organization have been working to put around our new graduates to ensure a successful transition to practice year, and what are the key messages that I want to share with her around this. So I talked about how there are a number of elements of organizational success in supporting her successful transition to practice that, we are committed to and dedicated to and putting around her. And it starts with assessment. How do we together determine what your learning plan your learning course should be as you enter our organization. And I talked about our processes around completing ISAs and IDPs and charting a course and having that all memorialized, formalized. I talked about the processes and procedures of support we have in place, a formal orientation program, organizationally trained and certified preceptors. Every clinician has an assigned resource clinician, whether it be a physician or a nurse practitioner, who's available whenever they're in clinic for real-time clinical consultations. I talked about clinical decision-making tools we have, best practice advisories that we thread in, how we try to keep things at the fingertips of clinicians, and talked about the wide range of educational activities that we offer, like virtual grand rounds, and that we have a dedicated, resourced, nurse practitioner-led educator team. Talked about how we're going to monitor progress and success. And in that, we talked about surveys, both on her part, as well as the part of preceptors, mentors, our clinical managers, dashboards, 100% chart review during that important year into our organization. And then we talked about mentorship, how important mentorship was. And if she were to join our organization, I would expect her to be an active an engaged participant in mentorship. And she asked me about that. Tell me about that. I would think maybe that's something I would need to have later, or if I was trying to become a leader. And I shared with her how in our organization, several years ago, we created a fellowship program for new graduates coming in. And we did a lot of data collection and analysis looking at all the different variables we built into this program. And what we learned was that the most impactful and influential variable driving successful transition to practice, driving progress towards self-efficacy and clinical competency and confidence, was a new grad having a quality mentorship experience with a seasoned clinician. By far, statistically significant, the #1 most important variable. So this is table stakes in our organization for you to come in. And she said, oh, that sounds terrific. I think I'm getting this now. And then she asked me, well, what happens after the first year? Am I just dropped like a hot potato? Is this done? I said, oh no, there's more. Certainly, mentorship lives not only in the experience, but it also lives in the culture of our group practice. So we work very hard to create a wraparound culture that embodies mentorship, but also delivers on those things, including those work-life balance elements you shared, that are so important to you, not only as a nurse practitioner, but as a mom, as a colleague, as a friend, as a person who participates in society. And the way that we approach that is we follow the framework of ANCC Pathway to Excellence, and we build programs and initiatives within the 6 standard pillars, which include transformational leadership, shared decision-making, quality, safety, well-being, and professional development. And those are an important part of the wraparound to mentorship and a program of preparedness to help support your success as a new grad. So then she asked me, she said, this sounds great. She asked me, what does success look like to you? And I said to her, an important part of success is that what you bring to the table as a new grad. So first and foremost, what I need you to bring to the table is that you are part of this group practice to bring our purpose to life. The embrace of evidence-based practice. All of the things that we do to deliver a quality patient experience delivered with compassion. That we are aligned in our purpose, that the work of this practice is the work that aligns with you aspirationally. Very important as we do this journey together. And then secondly, that we have clear understanding. What I own as an employer is to resource this, budget this, develop these programs, resources, put them around you, and what you own is being an active learner, a participant, part of charting this course. You're engaged, you're committed to the process from beginning to end. I shared with her that table stakes also meant that she would know and use all of the resources that are around her, that she have a commitment to being mentorable and teachable, that she prepares for these sessions, whether it's a mentor conversation or a clinical consult with a resource nurse practitioner, that she presents in SBAR format, that she shows up at these interactions teachable and mentorable. And I also shared with her that in this organization, as part of the culture and supporting this culture of mentorship, that you view performance discussions and feedback as a gift. It is a gift to understand your strengths as well as your opportunities, and the gift to have access to resources to ensure you're completing your charted course on being a fully realized nurse practitioner. And certainly for me, what success looks like is that you're a contributing, engaged, culture-leading, innovation ambassador, embracer of our purpose, member of this group practice for many years to come. So I'll share with you that Carrie did accept the position. I was very glad, as I was exhausted after that call. And she did accept the position, and I've been keeping track of her progress and doing beautifully. And just a couple of months ago, I received a wonderful letter from a mom who sent me a letter to say, I just have to celebrate this practitioner who saw me and my son on a Sunday morning. The next day, we were supposed to go on a family vacation, and he was ill, and just went on to say how not only excellent was the care, that she was there for them on a Sunday morning, but that the visit was of just terrific quality, and she delivered the visit with compassion and caring like she had never experienced before, and that this visit made such a meaningful difference to the life of this mom and her son. And I gave Carrie a call to share this with her and celebrate her and recognize her. And she said the best thing on the phone. She was very appreciative, and she said, Angela, I just love my job. I love what I do. I'm so happy, and I'm so grateful for, the guidance and and having a path in front of me to be able to fully realize what I always hoped to be as a nurse practitioner. So for me, this made my day certainly a tremendous success and a testament to how being planful, mindful as an employer around supporting our newest colleagues is meaningful, not only for the patients and families and communities we serve, but also for our profession. Thanks, everyone.
Annie, do you want to tell us a little about your work-life balance from that perspective?
Yeah, I work for a company called Parsley Health, and I'm a new graduate nurse practitioner there. There's 3 offices. I'm in LA. My counterpart is the other nurse practitioner within the company is in New York. And so she and I have weekly meetings, and she is one of my mentors, but I have a collaborating physician here in in LA, and learning and development collaborating physician here in LA. My company is very much into work-life balance. I am fortunate to work 2 days from home. I work 2 days in my office, and even that is, can sometimes be adjustable. We have a 12-week fellowship when we start. All providers do, MDs, DOs, and nurse practitioners. And it's an opportunity to collaborate with other physicians. We have health coaches within our company. They're registered dietitians, and so they educate us about the diet and lifestyle ways that we can support our patients. And so my company has a whole arm of their within the organization that is devoted to learning and development, we have company-wide meetings quarterly. We just had one in which we had a speaker named who specializes in microglia and the effects it has on the brain. And so our learning and development day was geared towards learning more about that and how we can all collaborate as a team. So like I had mentioned earlier, I worked in large hospital systems. I did clinicals in large hospital systems, and I saw there are times where the nursing education department is completely diluted and understaffed, and there are very few resources. And so I'm very fortunate to be part of an organization that really supports the development of our clinicians, that wants us to have work-life balance. We just had a collaborative meeting on Friday about COVID-19 and our stance on it and what we want to inform our patients about. And we had this big article we published on our organization's blog for patients, for anybody. And Saturday morning, one of the doctors who authored it, basically said, here's the article. When your patients are writing into you, you can refer to this, but try and stay off your computer this weekend. So we do really try and, there is a lot of mentorship within the company, and not just in the clinical arms, the tech arms, the marketing arms. It's a startup company, so they're just looking for growth everywhere. So
Thank you.